Good day, madam. My name is Tarini Anaprabha Ravitran, and my matrix number is P4240061. Today, I will be presenting my assignment on two types of pharmaceutical products, which are ophthalmic products and parenteral products. First, ophthalmic products are steroid preparation used for application to the eye, while parenteral products are steroid preparation administered into the body through injection. In this presentation, I will focus on two examples, which are nickel eye drops as an ophthalmic product and cefroxone as a parenteral product. Today, I will explain their formulation, indication, mechanism of action, side effect, and proper method of administration. And also, I will explain how to use it and the storage of the each product. So, what is ophthalmic product? They are sterile preparation designed for application to the eye. They must be free from microorganisms, particles, and irritation because the eye is extremely sensitive part. These products are used to treat infection, inflammation, or dryness on our eye. Next, there are few types of product ophthalmic. First, ophthalmic solution, which is eye drop. It is a liquid form, solution, emulsion, or suspension, commonly used for treating allergies or bacterial infections. Next, ointment, which is in a form of semi-solid preparation that stay in the eye long, often applied at night for lubrication or any infection controls. Next, ophthalmic gel or in situ gel, which is in a viscous form of liquid that turn into gel upon contact with the ice, pH, or temperature for prolonged release. Next, conjunctival insert. This is a solid gel-like device placed under the eyelid for slow medication delivery. And the last one is intraocular injection, which is a invasive specialized injection used to treat deep eye conditions. So, this is the generic and brand name. For this product, Nicole is the brand name, while the generic name is chloramphenicol. The generic name represents the active ingredient responsible for the therapeutic effect, whereas the brand name is given by the pharmaceutical company for marketing purpose. So, the formation of Nicole eye drop contains chloramphenicol 0.5 percentage of active ingredient. It also includes excipients such as purified water as a waiter, boric acid as a buffer to maintain pH stability, and the preservative like benzalkonium chloride to prevent microbial contamination. Fine. So next, nickel eye drop, which contain chloramphenicol, are indicated for the treatment of bacterial eye infection, which is particularly conjunctivitis caused by susceptible organism. By using nickel eye drop, it can help to eliminate bacteria and relieve symptoms such as redness, discharge, or irritation on your eye. So next, chloramphenicol is a broad-spectrum antibiotic used in the treatment of superficial eye infection, which is particularly bacterial conjunctivitis caused by susceptible organisms. Adverse reaction of nickel eye drops, which contain chloramphenicol, may include mild eye irritation, burning or stingy sensation, temporary blur vision, and in rare cases, it may also cause allergic reaction. But these side effects are usually mild and temporary only. So patient no need to worry about either they need to surgery their eyes or whatever else. So how to use the chloramphenicol eye drop? First, We need to wash our hands cleanly. Next, tie head back, then pull lower eyelid down and slowly instill 1 to 2 drops into the eyes. Next, close eyes gently. Please don't blink the eyes repeatedly. And lastly, the eye drop may use every 4 to 6 hours or as prescribed by doctor. As a precaution or cautionary level, this eye drop is only for external use. Do not touch the dropper tip to avoid any bacteria or microorganism contamination. Next, avoid wearing contact lenses during the treatment. And lastly, and most important thing is the eye drop must be kept in the refrigerator. As I said earlier, the eye drop need to be kept in refrigerator under 2 to 8 Celsius before opening to maintain the stability of the eye drop. And as a disposal, please discard within the 28 days, which is 4 weeks after opening the eye drop. So this is the example of the nickel eye drop. Next, I'm going to talk about parental products. So, what is parental product? Parental products are steroid preparation administered by injection or bypassing the gastrointestinal tract. They must be pyrogen free, sterile, and isotonic to ensure patient safety. They are also used when rapid is required or when a oral administration is not suitable for the patient. There are a few types of product, which is subcutaneous, intravenous, intracardial, intraosseous, intrathecal, intrapleural, intracerebral, intramuscular, intradermal, intracisternal, intraarterial, intraperitoneal, and also intraarticular. Next, generic and brand name. For this parental product, there are generic name that called cefroxone, which is the active ingredient, while the brand name is Rosafrin, given by the pharmaceutical manufacturer. The formulation consists of ceftriaxone sodium as the active ingredient. It is available in a sterile powder form in a vial and requires reconstitution with sterile water for injection or a suitable diluent before use. So, ceftriaxone injection is indicated for the treatment of severe bacterial infection, pneumonia, meningitis, sepsis, and UTI, which is urinary tract infection. The mechanism of action is ceftriaxone works by inhibiting bacterial cell wall synthesis by binding to penicillin and proteins. This, we- this weakens the bacterial cell wall, causing the bacteria to rupture and die. So, the ceftriaxone injection may cause some adverse effects too, such as pain at injection site, diarrhea, allergic reaction, or a rare case like anaphylaxis. Next, instruction on how to use. The injection must be administered by a healthcare professional, which is doctor or nurse. IV is a slow injection or infusion. IM is a deep intramuscular injection. The dose depends on infection and the severity of the health issue of the patient. As a precaution, Doctor or a nurse need to check for penicillin allergy of the patient. Next, do not mix with the calcium containing solution, and also uh, the healthcare profession need to use a SFT technique when they administer injection on patients. For storage, the injection must be stored below 25 Celsius. Next, the injection powder form in a vial. Next, the injection need to be reconstituted before use. It's the example of cephaloxime injection, which is rosafin.